Potter, I have, my line of questioning is for you. Are you a healthcare professional?
I have been. I'm not now.
You were. What was your level? What was your title?
I was Vice President of Corporate Communications for Cigna Corporation. Before that, I was
Are you a
Humana.
physician?
No, ma'am.
Are you a nurse?
I'm not.
Okay, so you don't actually, you have not earned a degree in any type of healthcare profession.
That's correct.
Okay, well, I am a nurse. Okay, I have been for over 21 years. And I want to go to your example, Ms. Leslie Elder, because I too have a mother and had a mother. My mother died at age 73. How old was Mrs. Elder when she died?
63.
She was 63. And you had mentioned that she had a treatable, chronic but treatable condition, and then I think later you mentioned that she had breast cancer.
She did.
And that she had died of breast cancer.
She died of Hodgkin's lymphoma, as I recall.
So she had a form of cancer.
That's correct.
Now, I'm assuming that she had gotten a diagnosis. She didn't have health care insurance prior to this point.
What happened is her husband was a small business person.
Mm-hmm.
He owned an auto repair business.
Did she have, yes or no, did she have health care insurance at the time of her diagnosis?
She did when she was first diagnosed, but after after her initial treatment, the insurance companies raised the rates on the policy so much that he had to drop the coverage.
I had the opportunity very recently to actually visit the cancer center in my hometown of Dunn, North Carolina. And I actually had this very conversation with them. They're doing excellent work. And one of the things that I wanted to clarify was that what happens with someone who gets a diagnosis of cancer if they are not insured? Where does that go and unable to work? And oddly enough, Medicare disability is something that they can receive. Now, you mentioned also high-risk pools, and that she and her husband were not aware of that. Is that correct?
That's correct.
And you also mentioned that this was something that she was receiving treatment. Now, it's curious to me as to how she could have been receiving treatment and yet not know about high-risk pools and also not know about the possibility of being put on Medicare.
The high-risk pool was eligible for her toward the end of her life. She was diagnosed with breast cancer earlier.
Okay, and when was she diagnosed with breast cancer?
I don't know the exact year. I think it was around 2002 or something like that.
And she died?
She died last summer. Yeah.
Okay, so she actually had, her length, she lived
She had a pre-existing
years.
condition, that's right, and that's why their premiums went up so much that they had to drop
Okay,
couldn't afford it.
but the availability to get coverage after that was there.
Ultimately, it was.
And they did not take part in it.
They didn't know about it. That's correct.
They didn't know because the healthcare providers did not. We have discharge planners, we have social services, we have physicians, we have nurses that are giving treatment. I have a hard time believing that this was all taking place and that they did not understand this.
Well, Congresswoman, I would suggest you might talk to Mr. Elder and ask him these questions. I don't know, but I'm told
what you mentioned the daughter, and that the daughter said, and if I can quote you, that if she felt that if Obamacare had been in place, that her mother would not have died. Is that correct?
That's correct.
Do you have a mother?
I certainly do, and she is 88 years old.
And you would like to see her live a good, long life, wouldn't you?
And she has. I've been very blessed.
And that's a blessing. And my mother died at age 73, unfortunately. She had Alzheimer's, but she also received very good care, excellent care, because she had very good coverage. She was also on Medicare, but she still died. And that's a loss. And I understand that Ms. Elder's family is experiencing a loss as well, but I find it curious that you used her as an example of why Obamacare would be such a good plan to be put in place, and that somehow this would have saved her. Is that not what you're claiming?
The point of telling her story was to point, if you look at the written testimony, that they were priced out of being able to offer coverage.
But there was other coverage that in fact, and that's
not during most of the time that was available to her.
Those of us in healthcare understand that these reforms have needed to be put in place for a long time, and we're ready to work on those things for healthcare solutions. However, there was other availability there, so I just
not during most
I'm
of the
not
time.
quite sure I'm
not during most of the time,
understanding.
Congresswoman.
not Medicare?
I can, if you would like, I can tell you more about their situation so you can
Well,
get
no, I don't think we need
proper
to. And my time has expired, but I find your testimony disingenuous. Thank you, sir.
And the gentlelady